Good day to everyone. Today we're going to be discussing a mental health nurse who's been struck from the register. This one is probably going to be a bit longer because there are a lot of charges, and this nurse happens to be quite senior, coming in at band 7, which means they would have had managerial responsibilities, and the charges relate over a sort of 2 to 3 year time period. They were working as a community nurse and a team leader, and so it looks like the person had been delivering care as well as managing staff, because not all band 7 roles involve sort of patient contact, or at least patient contact which involves formulation of care plans or doing visits and such. That's not always the case. Usually the band 7s will be more office or desk bound. So there are a lot of charges which they've levied against them over a long period of time. So we're going to go through them. I'm going to skip over some of the ones which repeat, but just to get an idea of what she's done wrong. Did not enter or deduct that 2 medication amps were given to the medication balance sheet. Okay. Did not document on the MAR chart. A MAR chart is a medication administration record. So did not document on the MAR chart or the patient communication record sheet that an ampule was deducted. Okay. Did not document on the MAR chart. Okay, it's the same thing again. Okay, didn't see a patient for a period of 4 months. Wow, okay. I mean, most patients on a community psychiatric nurse's caseload are going to be seen about weekly. I mean, some could be seen more scarcely, but 4 months, if they needed someone checking in on them that infrequently, they would probably be discharged from the caseload. Tends to be for people who need a little bit more close monitoring than that. So clearly a big violation there. Administered a reduced dose of flupentixyl decanate without authority. So that's an interesting one, because a lot of nurses come into situations like this where they don't have enough of a medication. Perhaps a doctor has prescribed over the BNF limit, which is the British National Formulary. In cases, especially with antipsychotics, which this is, there's a lot of restrictions on what you can and can't do, especially over the BNF limit. It doesn't give any detail like this in the document, but we can only assume that a reduced dose was given for some reason. I don't think that she would have done it just because she felt that it was too much, although you can never be sure with some of these. She probably had some issues either procuring the medication or with the prescription, so she's given a lower dose, but she hasn't spoke to a doctor about that before they've done it. And you can't do that. You can't do that. You've got to go and speak to a prescriber or a doctor to alter the prescription. You can't give less. Did not document or advise the treating consultant that the care plan was not being adhered to. So that's just the previous charge. Didn't tell the doctor what they'd done. A patient had informed the person that they were using Valium, and she didn't do anything. That's a big one, because if someone's abusing drugs, what they get prescribed may or will change because of the risks associated, especially with Valium. Valium's just a brand name for diazepam. But diazepam is a benzodiazepine. In the vast majority of circumstances, they're not stacked. So if a consultant was going to prescribe another like clonazepam and the person's taking diazepam already, you can get issues with respiratory depression. And for example, in a lot of circumstances, you're not supposed to prescribe opiate type drugs with benzodiazepines. Again, if they haven't been prescribed a diazepam, and a doctor could prescribe anything for any reason, who knows? And without that knowledge that that person's taking illicit diazepam, the results could be fatal. So it's very, very poor practice there. I feel like that was very black and white. There's just no reason not to do that. Did not maintain communication and or visit a patient between the 13th of June and the 30th of April. 2014, 2015. So almost a year. That's just insanity to me. That's absolute insanity. I mean, a delay of a few days is understandable, but a year, almost a year, that is just no excuse. Did not follow the correct procedure when discharging the patient, in that you did not undertake a CPA review. That's a care plan approach meeting where you just discuss what the plan is, how they're going to move forward, or what changes are going to be made. Usually involving a doctor, nurse, perhaps an occupational therapist, other professionals. Did not send a discharge letter to the patient. Not the worst offence, especially if the patient's been informed by phone call or other means. It's not the worst. Did not send a discharge letter to the patient's GP. Okay, that's a bit worse, because if a GP assumes that you're under a community team's caseload, then they may not prescribe medications that they feel that you may need. They'll be trusting in the expertise of the psychiatrists and the team that they're under. Did not document and or administer the patient's medication which was due. That's just idiocy. Did not document any patient entries in the patient's communication notes. Okay, it's just the same stuff, really. Did not document or administer an injection. So she's signing medication out, which she's not given, I think, by the looks of it. Did not administer or document the patient's depot injections. So depots are long-acting injections, commonly given to people suffering with mental health problems in the sort of psychiatry area of medicine, for reasons of compliance, or sometimes it just works better, patient preferences. Tend not to like to prescribe it just based on preference, but if there is a strong preference for it, they can. It usually involves monitoring how much a patient's having medication-wise. If they frequently stop taking their medication and become unwell, then they can give a depot once a week, once every 2 weeks, once a month, and that stops all those problems, keeps them out of more inpatient settings, and allows them to live their life in the community. So they were not administered or documented on 3 occasions. You see, that could cause a patient to become admitted, or at the very least have a really, really rough time if you're not given these medications. So again, really poor practice. I mean, it just sounds like, to me, it just sounds like laziness. It's just stuff that's just not being done. It's just like, here's some stuff that you need to do, and they've just decided, nah, I'm not going to do it. It's just stupidity, really, a laziness. Did not keep medications securely in the following. That was kept in your work drawer. So she's keeping medications in her drawer at work. Again, it should be in a locked medication cabinet. Did not dispose of, use needles correctly, and that you kept them. Wow, that's just... I'm starting to get a vibe of laziness with this person. Like, the medication, the used needle bins are usually around. In the community settings, they can be a bit rarer, but they're not so rare that you're having to keep needles in a drawer in your work office. That's just laziness. Okay, used and unused. I was trying to see. I thought it was the same thing they'd written. No, she's keeping used ones and unused ones in her drawer. Wow. Okay, did not keep patient's notes, and that you kept them in your work drawer. Now, I don't know if that is unsecure, though. It depends what they mean by that. It could. Was it a locked drawer? Was it in a locked room? I don't know. I guess that it must have been an open access area of some description. Otherwise, I'm assuming they wouldn't include it. But again, there's no information really surrounding that as to why that's the case. So in regards to another patient, did not ensure that a care plan was in place. That's just really basic stuff, real simple. Did not ensure that a risk assessment was in place. Again, that's mental health 101. Did not carry out a follow-up visit as required within 7 days. Patient being discharged. You know, a lot of places, I mean, this was in 2014, but a lot of places usually require 72 hours, 3 days to be followed up when they're discharged from a case, sorry, from an inpatient unit. If you're being discharged from a community team, they don't usually follow up. It's usually after being discharged from an inpatient setting. The 7 days is generous. They didn't do it. Did not carry out a follow-up visit. Yeah. Did not put a care plan in place. It's just more and more of this. Did not formulate a risk and relapse plan. Again, another patient. Didn't visit him. Didn't do anything. Again, another patient. Another patient. Another patient. Same again. Okay, so she's got what we'd term a forensic patient on her caseload as well. And when you have people who have been convicted of criminal offences and mental health has played a role in that, then they can be sentenced to stay in an inpatient unit. They'll have to be monitored by community mental health teams. And so the Ministry of Justice is involved with those types of patients. They're usually on a special type of section, which is different from sort of your quote-unquote mainstream sections. And so the Ministry of Justice have to be kept up to date where the person's living, if there are any changes, any risks. So you have to work with them. She didn't submit reports to them. Again, potentially a very dangerous person as well. Again, so it's just really, really poor practice. Potentially putting the public at risk by not cooperating with the Ministry of Justice there. It's very, very serious. And then told other staff that they had visited the patient when they didn't. Yeah, now we've got dishonesty, we've got laziness, poor practice, putting people at risk, and now we've got dishonesty. I think this might have the full shebang. All we need now is for the person to physically assault someone, and then they've got the complete set. And then again, lied again, said that they had completed a risk plan, but did not document or communicate with the patient's GP. It just goes on and on and on. This is just terrible. Yeah, so they've been struck from the register. They had some witnesses come in, a band 8C, service manager, care officer, non-medical prescribing lead. So that would be a nurse practitioner usually, but it can be a pharmacist and other professionals. And so they found the vast majority of the charges as proved, which means on the balance of probability, which isn't the highest level of proof really, not at all, just whichever was more likely to happen. But so many charges. The document's over 100 pages long with all the things that this person had done. And so they've been struck from the register. And I believe almost all of the arms of the grant test were enacted there. They've put 3, but I actually think there was dishonesty involved, so I don't understand that they've missed the 4th one out. But it clearly said before that she was telling people she was doing things when she wasn't, so it would have actually been all 4 arms. Put the patient at unwarranted risk, brought the profession into disrepute, absolutely. Breached the fundamental tenets of the medical profession, absolutely. D, acted dishonestly, yes. So it should have been all 4 limbs of the grant test. and that's never going to work out well for anyone. They didn't attend the hearing either. So, thanks for listening to me drone on.